It's Dr. Centeno, and today I'd like to talk about whether Lipogems is a stem cell procedure. Basically, Lipogems is a pretty neat device that you put the fat in and you shake it with these little balls, these little metal balls that are inside this container, and it kind of shreds the fat. And it tends to produce these very small little chunks of fat called micronized fat. And there have been thoughts that lipogems can mince the fat so finely that the stem cells and the adipose chunks can climb out. So I've talked to a lot of physicians who believe that Lipogems has a stem cell type approval for knee osteoarthritis, but that's not really what their FDA device approval states. That's right here, and it says that their device approval is for concentrating and transferring adipose tissue in multiple different types of surgery. You see nothing about stem cells, you see nothing about knee osteoarthritis, but that's the most common use for this procedure. So it seems like the most common use for this device is actually out of sync with the FDA approval. So despite the FDA approval for a device that's a fat graft, and in fact, if you go on Google right now and you type in Lipogems, the number 4 item there that comes up is Lipogems stem cell. So we have a lot of patients that are searching for Lipogems stem cell, which means there are a lot of physicians out there telling a lot of patients that Lipogems is a stem cell procedure. So is it ethical to advertise Lipogems as a stem cell procedure? Meaning, is it really? Well, we tested 2 Lipogems kits versus this simple setup in our advanced research lab. That's just one syringe connected to another with an inexpensive Luer-Lock connector so you can pass the fat back and forth. What did we find? That 50-cent Luer-Lock connector worked as well as a Lipogems procedure or kit to free up stem cells. And neither of these techniques produced more than a tiny fraction of the stem cells that were available in a simple bone marrow concentrate. So is Lipogems a stem cell procedure? The answer is not really. And I feel a little bit like this guy here saying, throw me a freaking bone, because this is yet another example of physicians advertising things that really aren't accurate or remotely true. So for more information, see regenetics.com. Thanks so much and have a great day.